I'm Dr. Emma Hitt Nichols, and this is this week's edition of New FDA Approvals podcast. I hope you'll tune in every Monday. I guess we don't tune in, right? Download, whatever. Every Monday to hear the latest updates on the new FDA approvals. If you do this every week, it's a good habit to get into so that you can stay up to date. All right, here's information on the latest FDA approvals for last week, August 7th through the 11th, 2023. We have Akeega for BRCA-positive metastatic castration-resistant prostate cancer. We have Talvey, also called talquetamab, TGVS. That's a bispecific therapy for multiple myeloma. We also have Erzurvay for geographic atrophy related to AMD. We also have POLARx cryoablation system for paroxysmal atrial fibrillation. And you can see the full write-ups for today's episode at nascentmc.com/podcast. The FDA has approved niraparib and abiraterone acetate as Akeega, Akeega, and that's the first orally administered treatment for BRCA-positive metastatic castration-resistant prostate cancer. The tablet combines niraparib, a PARP inhibitor, with abiraterone acetate, an anti-androgen. Approval was granted based on findings from the phase 3 magnitude study, which involved 423 patients. The study showed that the treatment group, especially those with BRCA gene mutations, had a significant improvement in median radiographic progression-free survival compared to the group receiving only abiraterone acetate. Both groups also received prednisone. The safety profile resembled that of individual monotherapies, with serious adverse events occurring in 41% of patients, leading to a 15% treatment discontinuation rate due to adverse reactions. Approximately 10 to 15% of patients with metastatic castration-resistant prostate cancer have BRCA gene alterations. The approval was granted to Janssen Pharmaceuticals. The FDA has granted accelerated approval of Talvey, Talvey, that's talquetamab, TGVS, a first-in-class bispecific antibody for the treatment of adult patients with relapsed or refractory multiple myeloma who have received at least 4 prior lines of therapy, including a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 antibody. This indication is approved under accelerated approval, and continued approval for this indication is contingent upon verification and description of clinical benefit in the confirmatory trials. Talvey is a bispecific T-cell engaging antibody that binds to the CD3 receptor on the surface of T cells, and also a member of the G protein coupled receptor family, GPRC5D. And that's expressed on the surface of multiple myeloma cells and also non-malignant plasma cells and healthy tissues such as epithelial cells and keratinized tissues of the skin and tongue. The approval was granted on the basis of results from the phase 2 Monumental 1 study. Similar to other bispecifics, the safety profile for Talvey includes a boxed warning for cytokine release syndrome and a neurologic toxicity called ICANS. The approval was granted to Janssen Pharmaceuticals. Is your company in need of medical writing assistance? Visit our website at nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more. And we can also do it with a quick turnaround and also on any therapeutic area. We're like your favorite freelancer who's always available. Do check us out at nascentmc.com. Also last week, the FDA has approved Erzurvay, and that has the generic name of avacincaptad pegol intravitreal solution. And this is a complement C5 inhibitor for treating geographic atrophy linked to age-related macular degeneration, or AMD. The approval was granted last week to Iveric Bio, which is an Astellas company. The decision is based on results from the GATHER1 and GATHER2 phase 3 clinical trials, where monthly 2 milligram injections of Erzurvay demonstrated a significant reduction in geographic atrophy growth rate. The slowing of disease progression was observed beginning at 6 months after treatment initiation, with up to a 35% reduction in progression within the first year. AMD, which has as one of its features geographic atrophy, is a leading cause of vision loss among people aged 50 years and older. Izervay is expected to become available in the US within the next 2 to 4 weeks. Also last week, the FDA has approved Boston Scientific's POLARx cryoablation system for the treatment of patients with paroxysmal atrial fibrillation. The device features the POLARx Fit cryoablation balloon catheter, which allows the use of 2 balloon sizes, 28 and 31 millimeters, in one catheter. Cryoablation is a minimally invasive procedure for treating atrial fibrillation, during which a balloon catheter delivers cryotherapy to the pulmonary vein, freezing problematic tissue and creating scarring that blocks irregular electrical signals. The POLARfit catheter facilitates a closer fit to a patient's individual anatomy during the ablation procedure, and that can help mitigate the need for device changeouts. The approval was based on data from the Frozen AFIDE clinical trial, which demonstrated the safety and effectiveness of the POLARx cryoablation system in 385 patients with paroxysmal atrial fibrillation. At 12 months, the rate of freedom from documented atrial arrhythmias was 79.9%. And then we just have one upcoming PDUFA date this week, and that's on August 19th for Revance Therapeutics, and that's for Daxxify, also called daxibotulinum toxin A, LANM. That's for injection for the treatment of cervical dystonia in adults. No other PDUFA dates are listed on the FDA calendar. So thanks so much for listening this week. Did you know that you can access our nascentmc.com/podcast page and search the notes from this and the previous podcast? So if you want to write a piece about, atherosclerosis, it will bring up all of the atherosclerosis-related therapeutic agents approved since the first episode on May 15th of this year. And then we also include the prescribing information and any other relevant information with each summary also, so that can make for easy researching. Do check that out again at nascentmc.com/podcast. All right, thanks so much and have a wonderful